Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist. I have a practice called Cognitive Psychiatry of Chapel Hill here in North Carolina. And today I wanted to talk to you a little bit about a very disturbing article that was in the New York Times this past Sunday. And without going into too many of the details, the article told a very tragic story of a young man who faked symptoms of ADHD, attention deficit hyperactivity disorder, to obtain stimulant medications. I think in particular it was Adderall, so that he could study and do well in his pre-med classes. And the story goes on to tell how he became addicted to the stimulants and he abused them, and the stimulants actually caused psychiatric symptoms like mood changes and some unusual symptoms called psychotic symptoms like paranoia. And these symptoms went on to cause a psychiatric hospitalization. And even after that, he was continued to be prescribed these medications and had a very sad ending to the story where he took his own life. Some of the points in this story that I want to talk about today are what the stimulant medications are, what it means that they could be abused, ADHD and how is it possible that someone could fake that, and also the role of the doctor in all of this, because I actually think that's one of the most important things, is the role of the doctor. So just briefly, stimulant medications are used to treat attention deficit hyperactivity disorder. They've been around for a long time. One class of medication are amphetamines like Adderall. People used to worry a lot about cardiovascular problems with these medicines, but recent studies have shown that they're very safe as long as you don't have an underlying heart or cardiovascular problem. So people with ADHD take these medications, and instead of making them more revved up, more hyper, they actually tend to calm them down, and that's called a paradoxical reaction. So these medications are often used to treat ADHD in children and then also in adults. Now, the complicated part is that the stimulants can also be used as a cognitive enhancer. And the idea there is that someone who needs to have a very high degree of focus, like someone studying for an exam, someone in college who has performance he or she needs to do really well, they may want to take these medicines to help them study. And the medicines kind of help keep you up, keep your energy up, and some people think it enhances their cognition in general. Now, the literature doesn't really support that. If you are a normal, quote-unquote, person, does not have ADHD, the literature does not support the idea that the amphetamines actually do improve your cognition, but people feel like it does. And probably the main reason they feel like it helps them is because their heart goes faster, they're more awake, they're more alert. So it feels like it's really helping. So these medications are used to treat ADHD. Another question that came up in this article was, well, how is this student able to get these medications and abuse them? And why would they lead to abuse? So this student would fake symptoms of ADHD. And what that means is he studied probably the definition of ADHD, he studied the symptoms, and then he would go to doctors and tell them that he had these symptoms. And since many doctors just rely on what the patient is telling them, and they don't really do a test of attention, it's pretty easy to fake the symptoms if you study up on them and you try hard enough. Now, some doctors and some psychiatrists will have you do some additional testing, which makes it harder to fake the symptoms, and I talk a little bit about this later. In any case, this student faked the symptoms, he obtained the stimulants, and then he became addicted to them. So how do you become addicted to stimulants? Well, stimulants are medications which work in your brain, and they can activate something called the reward pathway. And the reward pathway is a pathway in your brain that responds to pleasurable things. So normal, happy things in your life can activate the reward pathway, but drugs of abuse can also activate it. And when the drugs of abuse activate it, sometimes it's very strongly activated, and you can become dependent on the medications. So in his case, that's probably what happened. After taking them for a while, his brain got used to the medicines and he became addicted. The next step in this sad story is that he developed some mood changes because of the stimulants. Now, this is something that can happen, although I would say it's pretty unlikely it would happen if you were taking the medications as prescribed for ADHD, but it's not unheard of, certainly. I suspect in his case he was taking too much of this medication, and since he didn't really have ADHD, it was really setting his brain into an altered state. So he had some mood changes and some paranoia. And again, if you're taking the medication appropriately, this is very unlikely, but in someone who's abusing the medication, taking it over and over again when you shouldn't, it's possible. So after this person was hospitalized, he came out of the hospital and he was continued to be prescribed these medicines. And here's the point where I think this is actually one of the most important takeaways of the story. So even after he was hospitalized, even though people didn't think he had ADHD anymore, even though he had already been treated for the mood problems and the paranoia, he continued to get the medicines. And here's where the role of the doctor is so important. As a doctor, if you're going to prescribe these medications, it is very important that you don't just refill them without thinking or observing or testing or being very cautious. So there's different things doctors can do. They can have the person come to appointments more frequently. So sometimes the doctor will have you come once a month. They can do a test. Again, most doctors don't do this, but there are computer tests of attention that you can do. The doctor can look at a controlled substances database. And in North Carolina, we have one that any doctor can access for free, and you can see prescriptions for all controlled substances that person has filled. So if the person is going to 3 different doctors and getting prescriptions, you'll be able to see that. And under the law, you're actually allowed to notify the other doctors that are prescribing that this person is what we call doctor shopping or going to multiple doctors. So that's another important thing the doctor can do. In the story in the New York Times, I think one of the biggest tragedies was that the parents of this young man tried to contact the doctor, tell him what they observed, tell him that they thought he was abusing the medicines, that he was at risk. And the doctor told them, I can't talk to you unless your son gives me permission. I can't listen to you if your son doesn't give me permission. And while it is true that the doctor-patient relationship is confidential, the doctor cannot tell the parents things that the son has told him in confidence. It is not true that he couldn't listen to the parents. So the parents could have gone to him and told him what they observed, and he could have just sat quietly and not said anything. Now, in my practice, I've had this situation come up frequently where friends or family members think it's important to tell me something about the patient that they have observed. And the way I handle it is I tell them that I can't give them any information about that person. I can't even tell them if that person is in the practice. However, they can tell me whatever they want. If they want to mail me a letter and tell me their observations, they can mail it to me, they can call me, whatever. So the doctor can listen. He or she just can't reveal information. Now, the only exception to that is if the doctor feels that the patient is an acute danger to himself or herself or others. And what that means is that person at risk of killing themselves? Is that person at risk of harming someone else? Is that person at some sort of acute risk? And in that situation, the doctor can break doctor-patient confidentiality to make sure that nobody is harmed. But in most cases, he or she can always listen to what the other person says. So, kind of pulling it all together for this article, it was a very sad and a very scary story of what happened to this young man because of stimulant medications. And also because the medical system was not serving him well and allowing him to take medications that he didn't need and probably giving him too many of them. What most people have come in to talk to me about is the idea that, well, maybe I shouldn't take these medicines. Maybe this is too scary. This risk is too high. And what I feel from this article, the most important takeaway message is actually that the doctor really needs to be more careful. This is something that doctors need to think about carefully in their practices. They need to be cautious when prescribing these medications and thoughtful. And it really is our role to try to prevent some of this from happening. Now, of course, we can't prevent everything from happening. If somebody is going to go and do risky behaviors, we can't follow them around and know what they're doing all the time. But we can take some safeguards. We can have more frequent appointments. We can check the database to make sure they're not doctor shopping. We can do more extensive testing instead of just a verbal report. We can listen to information from friends and family. So there are things that we can do to try to minimize tragic things like this from happening. So I think if you've read this article and you're reacting strongly to it, again, I think the big takeaway is that the system doesn't work very well right now and that there are things that doctors should be doing to make it better. I think the second main takeaway should be that if you're a family member or a friend of someone and you think that they have a similar problem, like you think they're abusing these medications or they're pretending to have ADHD to obtain these medicines, you can share this information with the doctor prescribing. The doctor may not be able to tell you anything. The doctor may not be able to tell you that person even sees them, but you can provide that information to them. And hopefully the doctor will listen, and I think most doctors probably will. If you feel like your friend or family member is in danger, like you see them abusing these medicines and you really think they're going to harm themselves, or they could kill themselves, or that they're driving around impaired and they're going to hurt someone else, you do always have the option to take them to the emergency room for evaluation. And you can say that you think they need an emergency psychiatric evaluation because you think they're a danger to themselves. So you do always have that option. So I think that's important to know for friends and family. But the takeaway that many people get from this article is that these are bad medicines and that they don't help people and we should get rid of them. And I would disagree with that. I think when used cautiously and thoughtfully, these medicines help many, many people in their lives. But again, it's the doctor that maybe needs to be a little bit more cautious. So it's kind of a long answer to some of the questions I've been getting about this article, but I hope maybe it clarifies some things for you and tells you a little bit about my take on it. If you have more questions or you want to talk to me further about it, please feel free to contact me at the information below, and I'd be happy to help. Thanks. Bye-bye.